Hello, everyone. Our group is made up of Kaylee Curda, Morgan Grant, Danielle Marcel, and Brandy Perry, and together we'll be presenting our case study on panic disorder. We're going to start by looking at the client's background, then move into case questions, and finish with treatment options and a summary. Dennis is a 31-year-old divorced insurance salesman who comes across as confident, but he's struggled with anxiety for many years. He often deals with tension, headaches, and digestive issues, and he's had panic attacks a few times a year. After his most recent attack in a crowded mall, he started avoiding crowds and situations where he feels watched or judged. Even though he appears to be put together, he is very worried about how others see him. When Dennis has a panic episode, the symptoms come on suddenly and feel overwhelming. He trembles, has chest pressure, feels smothered, and gets dizzy. Between attacks, he experiences ongoing anxiety and stays away from crowded areas, restaurants, heavy traffic, and places like bridges. He uses humor to deflect and gives himself pep talks before work, which shows how much pressure he puts on himself. Even though he performs well at work, he deals with a lot of internal stress. Looking at his history, Dennis was a shy child and dealt with social discomfort and test anxiety during college. His first panic attack happened at age 24 during a dinner event. Medical tests showed nothing physically wrong with Dennis, and he briefly tried Xanax but stopped because of the side effects. His avoidance caused issues in his marriage, eventually leading to divorce. He's now engaged again and started behavioral treatment. Research also suggests that genetic factors play a big role in anxiety and panic symptoms, which fits well with his presentation.
For the first case question, Dennis does meet the criteria for both panic disorder and generalized anxiety disorder. His panic attacks are brief and severe, while his generalized anxiety is ongoing and affects his sleep, muscle tension, and daily functioning. Although the DSM lists these as separate disorders, they often overlap, which shows how common comorbidity is within anxiety disorders. The second question focuses on the difference between panic level anxiety and excessive worrying. A panic attack comes on quickly, reaches peak intensity within minutes, and feels physically dangerous. On the other hand, Dennis's generalized anxiety is steady, long lasting, and centered on future worries like work performance, being liked, or avoiding embarrassment. So the main differences are how intense the anxiety is, how long it lasts, and what it focuses on. In the beginning of therapy, Dennis was guarded and used humor to avoid opening up. This can make it hard to build a real therapeutic relationship because the therapist may not see the full picture of the client's symptoms. To address this, the therapist needs to use empathy, patience, and gentle questioning to help Dennis feel safe enough to lower his defenses. Over time, he started to engage more honestly in the process. For the question about medication, the therapist shouldn't pressure Dennis to take something he is uncomfortable with. Medicine can help with anxiety, but Dennis had negative experiences with it before and did not want to depend on it. The therapist's role is to provide accurate information, explain the pros and cons, and respect what the client prefers. Since Dennis was motivated to try CBT, supporting that decision helped build trust and kept him engaged in treatment.
Hi, Dr. Hale. This is Morgan Grant. And as I introduce the first treatment option for Dennis, I want to highlight why cognitive behavioral therapy is considered the gold standard for disorders such as panic disorder, agoraphobia, and generalized anxiety disorder. CBT focuses on how our thoughts, emotions, and behaviors interact. For clients like Dennis, who struggle with catastrophic thinking and perfectionistic self expectations, psychoeducation is an important first step. It will help him to understand how anxiety works physically and cognitively, and it reduces shame and empowers him to engage in treatment. A key component we would use is cognitive restructuring, which helps clients challenge catastrophic predictions such as, I'm going to have a heart attack, or if someone doesn't like me, I'm a failure. And by replacing those distortions with more balanced, realistic thoughts, Dennis will begin to experience a significant reduction in his overall anxiety. We would also utilize applied relaxation and diaphragmatic breathing, which would help Dennis to manage his chronic tension and interrupt the physical cycle of pain. For someone whose body was constantly in a state of hyperarousal, learning to relax his muscles and slow his breathing will be both grounding and restorative. Research strongly supports CBT as a long term sustainable treatment approach, especially for panic disorder and GAD. As a future Christian counselor, I appreciate that CBT aligns with biblical principles. Scripture teaches us that our thoughts shape our emotional and spiritual well being. For example, Proverbs 23:7 reminds us that as a man thinketh in his heart, so is he. Paul also encourages believers to take every thought captive to obey Christ in 2 Corinthians 10:5. So for Dennis, learning to challenge distortive thoughts would not only be clinically effective, it reflects a biblical approach to renewing the mind. Another evidence based option for Dennis is acceptance and commitment therapy, or ACT. While CBT focuses on changing the content of thoughts, ACT teaches clients to change their relationship with their thoughts. This means Dennis can learn to accept uncomfortable internal experiences without allowing these sensations or fears to control his behavior. ACT is especially useful when symptoms are persistent or when the client is exhausted from fighting their thoughts. For example, Dennis battled the fear of panic attacks so intensely that avoidance became a way of life for him. ACT helps breaks this cycle by emphasizing acceptance of internal experiences, mindfulness and present moment awareness, letting go of unhelpful mental habits like worry or self-criticism, choosing actions that reflects one's values rather than one's fears, and psychological flexibility, which allows clients to function even when symptoms arise. This is particularly important given the DSM-5 description of panic attacks, which includes symptoms such as shortness of breath, palpitations, dizziness, trembling, and overwhelming fear. ACT helps clients to respond to these sensations with openness instead of panic and avoidance. From a Christian counseling perspective, ACT principles harmonize beautifully with biblical teaching. Scripture repeatedly calls us to be present, grounded, and surrendered. Psalm 46:10 reminds us to be still and know that I am God, which echoes the mindfulness and acceptance components of ACT. Additionally, ACT's focus on values-based living mirrors Galatians 5:25, which encourages us to walk by the Spirit. So, in other words, we choose actions rooted in faith rather than fear. So, for Dennis, ACT would help him cultivate peace, acceptance, and a values driven life instead of one governed by anxiety. In closing, Dennis's case illustrates how a combination of panic disorder, generalized anxiety disorder, and agoraphobia like avoidance can deeply impact functioning. As our client, Dennis will begin learning practical skills to help him regain control over these symptoms and reduce the fear that has limited his daily life. In therapy, Dennis will start with relaxation training to help calm his body and recognize early signs of tension. From there, he will learn cognitive restructuring, which will help him challenge the catastrophic thoughts that have fueled his anxiety for years. As he grows more confident in these skills, Dennis will gradually enter feared or avoided situations, giving him space to test his new thinking and realize that he can handle discomfort without losing control. Through this process, Dennis will build confidence, decrease avoidance, and function more freely in his everyday life. Spiritually, this reflects the truth of Romans 12:2, which calls us to be transformed by the renewing of our minds. As Dennis practices these new patterns, he will begin to experience greater peace and freedom, showing how evidence based treatment and faith can work together toward lasting change. Thank you so much.